The pill that trips you. Why medications may be the real risk. Let me ask you a hard question. What if the thing makes you more likely to fall isn't your age, isn't your legs, and aren't your shoes, but the pills in your medicine cabinet? I know that's hard to hear because we're told medication keeps us safe. It lowers blood pressure, helps us sleep, eases pain, keeps anxiety away. And yes, those things are important. But here's what most doctors don't tell you. The very medications meant to help may quietly be putting you at risk of falling, not by accident, but by design, because as we age, our bodies respond to medication differently. The truth about medication and aging. As you get older, your kidneys and liver process drugs more slowly. Brain becomes more sensitive to sedatives. Muscles and balance systems become more fragile. Reaction time gets slower. So even the same pill you've taken for 20 years can suddenly cause dizziness, drowsiness, confusion, and loss of balance. And when you combine 4 or more medications, a situation called polypharmacy, your risk of falling more than doubles. According to the Centers for Disease Control and Prevention (CDC), that's not a small number. That's your life we're talking about. The problem: no one warns you. No one told you your sleep aid might make you fall. No one said your blood pressure pills could cause lightheadedness when you stand. No one warned that your over-the-counter allergy medication could cloud your brain. But now, you know, and this is where healing begins. Not with panic, but with knowledge and action. What this video will give you. In the next few minutes, I'll walk you through 10 common types of medications that increase fall risk. Why they affect older adults more. What questions to ask your doctor. How to protect yourself without sacrificing your health. Because you deserve to know what you're taking. You deserve to feel steady when you stand. And you deserve a care plan that protects all of you, not just one symptom at a time. Comment below, have you ever felt dizzy, off balance, or more tired since starting medication? Which drug do you suspect may be affecting you more than it should? Let's bring light to what's been kept in the dark and take control of your health together. Number 1, how medication affects balance, brain, and blood pressure. If you've ever stood up and felt your world tilt sideways, if you've taken a step and your knee didn't quite hold you, if your head felt cloudy even though your heart felt fine, it might not be just getting older. It might be your medication talking. You see, medicine affects more than the illness it's meant to treat. It also affects the systems that keep you upright, clear-headed, and in control. Let's look at how. 1. The brain's slowed signals and clouded thinking. Many medications cross into the brain and affect how quickly it processes information. That means you may notice slower reaction time, more hesitation when walking, trouble multitasking like walking and turning your head, even sudden forgetfulness or confusion. This is especially common with sedatives, pain meds, antidepressants, and anticholinergic drugs. For older adults, even small doses can have big effects. Why? Because as we age, our blood-brain barrier becomes more porous, letting more of the drug enter the brain and stay longer. 2. Blood pressure, the hidden drop that makes you fall. Many heart and blood pressure medications are essential, but they can also lower blood pressure too much, especially when you stand up. This causes something called orthostatic hypotension, a sudden drop in blood pressure when moving from sitting or lying to standing. Symptoms include dizziness, lightheadedness, blurred vision, feeling faint. And if you combine that with already weak leg muscles or poor vision, you've got the perfect storm for a fall. 3. Muscles and reflexes, the delay you don't notice until it's too late. Some drugs interfere with muscle tone, coordination, or nerve signaling. They make your muscles slower to contract or your reflexes slower to fire. You might feel off balance, heavy-footed, uncertain when walking in low light or uneven terrain. And often, the person taking the medication doesn't even realize it's happening until they fall. Why this matters more after age 60. The body changes with age, and that changes how medications work. Metabolism slows down, so drugs stay in your system longer. Kidney and liver function declines, making it harder to eliminate medications. Muscle mass and water content decrease, affecting how drugs are absorbed. Brain sensitivity increases, so side effects hit harder. So what felt fine at age 50 can cause instability at age 70, and what worked in the past might now need to be adjusted, replaced, or discontinued. Medication isn't the enemy, but mismanagement of medication is a silent threat. If you're feeling dizzy, off balance, or foggy, don't just assume this is aging. Ask, could this be my medicine? Comment below. Have you ever felt different, slower, unsteady, or more tired since starting a new medication? Let's talk about it because knowledge is the first step to safety. Number 2, sedatives and sleep aids. The nighttime fall trap. There's a quiet danger that visits many older adults long after the sun goes down. Not slippery floors, not dim lighting, not even nighttime trips to the bathroom, but something far more subtle, a sedative taken before bed. Sleep aids and sedatives are some of the most commonly used medications in older adults. They're prescribed to ease anxiety, help with sleep, and calm restlessness. And on the surface, they seem harmless. A single pill, a peaceful night. But inside the aging body, these medications may tell a different story. How they affect the brain. Sedatives act directly on the brain's central nervous system. They slow brain activity, dull alertness, and depress responsiveness in older adults, where the blood-brain barrier is more permeable. These effects can be stronger, longer lasting, and more unpredictable. The result, reduced coordination, slower reflexes, delayed awareness of surroundings, impaired decision-making in the dark or during unexpected events. This creates a perfect storm, especially during nighttime hours, when visibility is low and the brain is already operating at a slower pace. Why aging increases the risk? With age, the body metabolizes medications more slowly. What once cleared in 6 hours may now linger for 10 or 12. This means sedative effects can carry into the next morning, affecting balance, cognition, and stability even after waking. Also, the body's internal rhythm, its circadian clock, becomes more fragile with age. Sedatives may disrupt this rhythm even further, causing fragmented sleep, confusion, or disorientation upon waking. In many cases, the medication meant to restore rest can ironically reduce safety and increase the very problem it was prescribed to solve. The illusion of better sleep. Many people believe that a sedative equals sleep, but what's often overlooked is that sedative-induced sleep is not the same as natural, restorative sleep. These medications may help someone fall asleep faster, but they also suppress deep sleep and REM cycles, the very phases responsible for mental clarity, balance, and alertness the next day. Without true rest, the body does not fully recover. And with every passing night, small deficits add up, leading to more grogginess, less focus, and a higher risk of falling. Sleep is vital, but how you get there matters just as much as getting there. For older adults, any medication that changes how the brain functions overnight must be viewed not just as a sleep aid, but as a fall risk factor. It's not about removing all medication. It's about understanding the trade-offs and making choices that support both rest and safety. Comment below. Have you or someone you love ever felt more tired or unsteady after a night of using sleep aids? Do you feel like your mind is fully awake when you wake up, or does it take time to come back? You're not alone, and you deserve rest that doesn't come at the cost of your stability. Number 3, blood pressure meds. Too low can be dangerous. 2. Let's talk about something that surprises many of my patients. They think if my blood pressure is lower, that's a good thing. Right. Not always. Because while high blood pressure puts your heart at risk, low blood pressure puts your balance, your brain, and your bones at risk. And for millions of older adults, this invisible dip caused by medication is a silent reason they stumble, faint, or fall, especially when getting out of bed or standing too quickly. What is orthostatic hypotension? It's a condition where your blood pressure drops suddenly when you move from lying or sitting to standing. It's like your body can't adjust fast enough. The result, dizziness, lightheadedness, marartish, blurred vision, feeling faint or off balance. This moment of instability often happens just after standing up, and it lasts just long enough to make someone fall. It's more common in older adults, especially those on multiple medications. How blood pressure meds contribute. Certain medications lower blood pressure too much or too suddenly. These include diuretics, water pills, ACE inhibitors, beta blockers, calcium channel blockers. If your dose is too strong, or if you're on more than one of these, your blood pressure might dip more than it should, especially after long periods of sitting or lying down. And that's when the danger strikes, when your brain doesn't get enough blood fast enough to keep you upright. Why this affects seniors more? As we age, the body's ability to regulate blood pressure becomes weaker. Baroreceptors, the sensors in our arteries that help stabilize pressure, become less responsive. This means the system reacts more slowly. Blood doesn't move upward to the brain as quickly. Recovery takes longer. Dizziness becomes more likely. And if you already have weaker leg muscles, poor vision, or are recovering from an illness, a fall becomes not just likely, but almost inevitable. The worst part, many don't realize it's the meds, because orthostatic hypotension feels like I just got up too fast. I didn't drink enough water. I've been tired lately. And it gets brushed off when in reality, it could be a side effect of a life-saving pill. That doesn't mean you should stop your meds. It means you should talk to your doctor about adjusting them safely. Medication should support your life, not put your safety at risk. If you've felt dizzy or off balance when standing, don't write it off as just aging. It might be your body's way of asking for help. Comment below, have you ever felt dizzy or weak when standing up, especially in the morning or after resting? What medications are you on that affect your blood pressure? Let's bring this into the open because every stable step starts with knowledge. Number 4, meds that affect the brain: antidepressants, antipsychotics, and anticholinergics. There's a reason why some of the most powerful medications come with small print that says may cause drowsiness. Do not operate heavy machinery. But what if the heavy machinery is your own body? When medications affect the brain, they affect your ability to think clearly, react quickly, and most importantly, stay upright. This is especially true for a group of medications used often in older adults: antidepressants, antipsychotics, and anticholinergics. They are prescribed for real needs: depression, anxiety, sleep disorders, mood stabilization, overactive bladder, allergies, misbarnozone. But they also come with neurological side effects that can make walking, balancing, and responding to your environment more difficult and more dangerous. What these meds do to the brain. These medications often work by modifying neurotransmitters, chemicals that help nerve cells in the brain talk to each other. When those signals are altered, either slowed down, dulled, or blocked, the result is drowsiness, delayed reflexes, blurred attention, reduced awareness of your body's position in space. In younger adults, the brain compensates. In older adults, these changes can be overwhelming, leading to confusion, imbalance, or blackouts. The anticholinergic risk. Anticholinergic medications block the neurotransmitter acetylcholine, which is critical for memory, focus, and muscle coordination. You may not recognize them by name, but they're in many common drugs, including some for allergies. Incontinence, pre-autonom, Parkinson's symptoms, muscle relaxants, motion sickness. The danger is cumulative. The more anticholinergic drugs you take, the higher your risk for cognitive decline and falls. The American Geriatric Society even maintains a list of high-risk anticholinergic medications that older adults should avoid when possible. The vulnerability of aging brains. As we age, the brain becomes more sensitive to chemical changes, slower to adapt, less able to filter or clear medications efficiently. This means even standard doses of certain meds can lead to oversedation, confusion, or dizziness. And when this happens, a simple walk across the room can turn into a fall that changes everything. What you can do not stop these medications on your own. Instead, ask your doctor or pharmacist. Does this medication have anticholinergic effects? Request safer alternatives if available. Consider gradual dose reduction under supervision. Pay attention to new symptoms, confusion, drowsiness, loss of balance. Remember, and it's not just about managing your mood or bladder, it's about protecting your brain, your body, and your independence. Comment below, are you or a loved one currently taking any medications for sleep, depression, anxiety, or allergies? Have you noticed more brain fog or instability recently? Let's bring these questions to light so we can find solutions that heal without harm. Number 5. Painkillers and opioids. When relief comes with risk. Pain can be exhausting. It drains your energy, take away your joy, makes the simplest things like standing, walking, or sleeping feel like a battle. So when painkillers offer relief, it's no wonder people reach for them, especially opioids medications that promise powerful, fast-acting comfort. But here's what often gets overlooked. Painkillers may ease the ache, but quietly steal your stability, especially in older adults, where the line between relief and risk is razor thin. How pain meds affect the nervous system. Opioids and even some over-the-counter pain relievers don't just dull physical pain. They also slow the central nervous system, which governs alertness. Balance. Reflexes. Muscle coordination. This means that while your back or knees may hurt less, your body may also react slower. Your muscles may feel heavier, and your brain may take just a second too long to respond to a sudden shift in weight or footing. That 1 second is often the difference between staying upright and falling hard. The cognitive cost of comfort. Painkillers can also affect short-term memory. Focus. Awareness of surroundings. Depth perception. This fog can make you underestimate hazards, forget to hold the railing, or misjudge a step. And when opioids are combined with other sedating drugs like sleeping pills or anxiety meds, the risk of falling multiplies. The brain becomes less alert, the body becomes heavier, and the connection between the two weakens. Why older adults are more vulnerable? As we age, our metabolism slows. Our kidneys and liver eliminate drugs less efficiently. Our tolerance for sedation declines. So even a standard dose of an opioid can have stronger, longer-lasting effects in a senior than in a younger adult. What used to bring relief might now bring imbalance. What you can do, pain management matters, but it must be safe, strategic, and regularly reviewed. If you're taking pain medication, ask your doctor, is there a safer alternative for someone my age? Explore non-drug options like physical therapy, heat-cold packs, or acupuncture. Never mix opioids with alcohol or sleep aids. Pay close attention to new symptoms: drowsiness, fogginess, or off-balance sensations. Most importantly, don't suffer in silence, but don't fall in silence either. Comment below. Are you or a loved one using painkillers daily? Have you noticed changes in balance, memory, or alertness since starting them? Let's talk about the balance between comfort and real lasting safety. Number 6, diuretics and bladder meds. Rushing to the bathroom, risky. Imagine this, it's the middle of the night. Your bladder wakes you up, you swing your legs off the bed, you rush toward the bathroom, half asleep, in the dark, and suddenly you trip. This is not just a hypothetical. It's a common fall scenario among older adults, often caused by the medications they take every day. The bathroom rush, why it's so dangerous. Medications like diuretics, water pills, and bladder relaxants are prescribed to treat high blood pressure. Congestive heart failure, urinary urgency or incontinence. But the side effects: increased frequency of urination, stronger, sudden urges, nighttime awakenings. And what happens when the body sends an urgent signal to go, but the brain is still waking up? The muscles are stiff, and the floor is dark or slippery, a fall, one that didn't need to happen. The sleep-fall connection, when you're pulled from deep sleep by the urge to urinate, your brain is in a transitional state. Reaction time is slower, balance is poorer, judgment is impaired. Now combine that with sleep aid residue. Poor lighting. Cold muscles. Rushed movement. It becomes a perfect setup for losing balance sometimes in just 2 or 3 steps. The side effects of bladder medications. Certain bladder medications, especially those with anticholinergic properties, can lead to dry mouth. Constipation. Honey in confusion. Drowsiness. Poor coordination. These effects don't just affect the bladder, they affect the whole nervous system and can silently increase fall risk. Ironically, the drugs meant to help you feel in control might actually make your body less stable. What you can do: talk to your doctor about adjusting the time you take diuretics. For example, early afternoon instead of evening. Ask if there are non-anticholinergic options for bladder control. Set up nighttime lighting, motion activated or dim path lights. Place non-slip mats near the bed and bathroom floor. Consider bedside commodes if urgency is severe. Most importantly, don't let embarrassment keep you from asking for help. There's no shame in needing support, but there is risk in rushing in silence. Falls don't always come from weakness. Sometimes they come from urgency, from trying to move too fast when your body isn't ready. If your medication is pushing you toward unsafe moments, it's time to push back with knowledge and action. Comment below: have you ever fallen or nearly fallen while rushing to the bathroom? What time of day do you take your water pills or bladder meds? Let's make nighttime safer together. Number 7. What to ask your doctor. The medication fall risk checklist. You've made it this far, and that tells me something powerful about you. You don't just want to stay alive, you want to stay independent, steady, and strong. And that starts with a conversation, because here's the truth. No one knows your medications better than your doctor, but no one knows your body better than you. So the goal is not to fear your prescriptions, it's to partner with your doctor to find the safest, most effective plan for your body today, not 10 years ago. The fall risk medication checklist. Here's what I tell every patient over 60 to bring to their next doctor visit. 1. A complete medication list. Include all prescriptions, over-the-counter drugs, vitamins and supplements, herbal remedies, sleep aids or painkillers you take occasionally. 2. A symptom log. Write down any recent dizziness, confusion, falls or near falls. What time of day it happened. What activity you were doing. Whether you had just taken any medication. 3. Key questions to ask your doctor. Are any of these medications increasing my risk of falling? Do I still need all of these at my age? Could we lower the dose or stop one safely? Are there safer alternatives for someone over 60? Can we schedule a full medication review annually? These questions don't make you difficult. They make you smart, proactive, and safe. Be ready to speak and listen. Your doctor may explain that some medications are essential. That's okay, but they can still adjust timing. Lower the dose. Recommend lifestyle changes to reduce side effects. Refer you to a geriatric pharmacist for expert review. Remember, the goal is not zero medication. The goal is the right medication, right dose, right time. You don't need to become a pharmacist. You just need to become an advocate for your own brain, your balance, and your life. You deserve to feel clear-headed. You deserve to walk without fear. You deserve to ask the hard questions and get real answers. Comment below. Have you ever reviewed your full medication list with a doctor or pharmacist? What's one question you're going to ask at your next appointment? Let's turn awareness into action and protect your future. One conversation at a time. Let me be honest with you. This video wasn't meant to scare you. It was meant to wake up something powerful inside you. Because here's what I've learned after 50 years as a doctor. Falls don't start with the floor. They start with a choice. A choice to ignore or investigate. A choice to stay passive or take control. And by watching this, by questioning your medications, you've already made the most important step. You chose to protect yourself. Now let me ask, if you could do just one thing each day to make your legs stronger, your balance steadier, and your mind sharper, would you find 10 minutes? That's all it takes, not a gym, not fancy equipment, just a focused 10-minute routine that's built for people over 60. And in the next video, I'm going to show you exactly how, because medication is just one side of the story. Movement is the other. Comment below, what time of day do you feel most unsteady, morning, afternoon, or night? Would a 10-minute routine fit into your day? Let me know, I'm reading every word. See you in the next video. Dr. Muscle, I only have 10 minutes a day. What's the best routine for me? And I promise you'll walk away stronger.